Hi, I'm Dr. Adam Castricum, and I'm a sport and exercise physician at the Olympic Park Sports Medicine Clinic in Melbourne, and I'm also from the Australasian College of Sport and Exercise Physicians. And today I want to provide you with some key things that people with musculoskeletal conditions need to keep in mind during this time of COVID-19. I would like to acknowledge particularly our elderly, unwell, and also our Indigenous brothers and sisters, who are all in need of particular care and assistance during this difficult and uncertain times. I hope that I'm able to provide some hope and joy through the power of exercise and physical activity. So why is keeping physically active really important at this time? Being physically active gives you more energy, boosts your immune system, improves your mental well-being, prevents diseases like diabetes, heart disease, cancer, and dementia. It keeps you busy and breaks up your day, and also gives you time on your own to get some peace for yourself, but also to engage with others via technology. Fortunately, the current level of restrictions mean that we are still able to exercise outside. However, this may change, so it is important that you keep up to date with state and federal government guidelines regarding this. It really is important that we find different ways to exercise and keep physically active if our usual routines are disrupted. And we should aim as adults to exercise at least 30 minutes at a brisk pace a day. And for those under 18 years of age, and indeed children, they should aim for at least 60 minutes of brisk exercise a day. And it's important to get your huff and puff up and not necessarily sweat, particularly early on. You should also include strengthening and balance exercises two to three times a week. So what we should try to do, particularly outside, is walking with your partner from your household bubble, or with your kids or your dog. It can be some jogging or some jogging intervals, cycling, gardening, or even using exercise apps to help with this. In general, you should start easy and build up slowly. And remember, it's important that any physical activity is better than none. You shouldn't exercise if you feel unwell, and you should certainly call a doctor if you are worried. But it's most important during these times of COVID that you remember physical distancing and personal hygiene, which will help stop the spread. You should certainly stay at home if you feel unwell, and keep about 1.5 meters from others, which is your arm span, and away from others, and even more if you're exercising. You shouldn't touch common surfaces, and certainly don't share equipment, and also avoid groups of other people. And it's really important that your bubble doesn't touch another bubble. And you should also wash your hands before and after any exercise outdoors. Now, it's also really important that if you have a suspected or positive COVID infection, you'll be quarantined and cannot leave your home to do physical activity. If you're in a private house, you can use your garden, balcony, or courtyard, but you must be alone. And you can also keep active in your bedroom, provided you feel well enough. Now, if we do move to further restrictions, you and your family in your bubble may not be able to leave the perimeter of your private residence. So if you're in a private residence, you can still use your garden, balcony, or courtyard. But fortunately, most countries, even in the lockdown phase, have still allowed their residents to exercise outdoors, away from their home, as it is so important for their physical and mental health. But should we be restricted to our homes? A couple of simple activities you could do inside your home would include, you need to really move more and sit less. So that might be housework, stairs, taking phone calls while walking, or even home strengthening exercises such as sit to stand squats, or lying on your back and performing bridges and step-ups. You might even dance to your favourite music. You can also use YouTube video classes to help with this, which might include yoga, Pilates, or even Tai Chi, and other exercise apps. Now, a really fun and inexpensive idea that I've been doing at home with my family, my 3 young children, is we're trying to keep routine and fun and keep that in our days, because that's really important. So each morning, the kids and I call a Zoom meeting to a relative, whether it's our parents, grandparents, cousins, aunties, or uncles, or even their school friends, and we do a 10-minute exercise session with the family challenge. And that might include doing 30 seconds of squats, dancing to the Wiggles, or our favourite songs, walking up and down the stairs a few times, or even doing step-ups, or just walking around the house and just following each other around, making our favourite shapes of the animals that we love. And this can make it really fun and break up the day for all of us. So I hope there's some lovely tips there for you to keep physically active during these times. I'd like to thank Musculoskeletal Australia for the opportunity to talk to you, and remember to phone the Musculoskeletal Australia helpline on 1800 263 265 if you have any queries or need some further advice or support. Thank you.